Dear colleagues, my name is Taisia Averina. I am a psychoanalyst and psychodiagnostician at the International Center of Reproductive Medicine in St. Petersburg, Russia. A few words about myself. I graduated from East European Institute of Psychoanalysis. I am a member of the European Confederation of Psychoanalytic Psychotherapy and a delegate at the International Society of the Rorschach and Projective Methods, Switzerland. My professional interests lie in psychoanalytic psychotherapy, psychodiagnostics, TAT, Rorschach, MMPI, Zondi, and Wechsler. I would like to tell you about my experience in consultation of patients of assisted reproductive technology. I will start from afar. The distance between St. Petersburg and Brisbane is 14,381 kilometers. The time difference is 7 hours. St. Petersburg is 7 hours behind. St. Petersburg is the third largest population city in Europe, after Moscow and London. The population exceeds 6 million people. St. Petersburg is known as the cultural capital of Russia. Also, it is well known for its great number of isles, rivers, and channels. Sometimes St. Petersburg is called Northern Venice. It is located between the Baltic Sea and Ladozhskaya Lake, the biggest and the deepest lake in Europe. The International Center of Reproductive Medicine was founded on the 16th December in 1992. In 1995, the first pregnancy and childbirth according to the program of surrogacy in Russia and territory of former USSR was recorded. Today, ICRM is one of the most effective ART centers in Russia. For 24 years of successful overcoming of infertility by means of artificial reproductive technology, more than 15,000 healthy children were born. Average frequency of patients' pregnancy is from 49 to 54.4%, whereas the average Russian and Central European results, according to the data of Rauch and Escher, don't even reach 40%. As you can see from the chart, efficiency of ICRM significantly exceeds Central European figures. At the same time, 77.6% of pregnancies end with childbirth. The center provides the maximum range of services in the field of ART. Patients can carry out all procedures, research and examination in one place. ICRM has its own genetic and embryological laboratories and also owns donor bank of ova and sperm surrogacy mothers. Specialists of the center annually send a report to the National Register of ART Centers, which is kept by the Russian Association of Human Reproduction, guaranteeing thus reliability and openness of all work. Common and the most effective method of infertility treatment in present time is in vitro fertilization. Average duration of the procedure is 3 or 4 weeks. Patients visit the clinic during this time about 5 times. A consultation with a psychologist isn't obligatory, but is advisory before the IVF treatment. Patients have an opportunity to get 1 free consultation before further paid visits. Usually, I recommend at least 3 consultations. After a visit with a doctor, after an egg retrieval procedure, after or before embryo transfer. The primary focus of my work is to discuss and clear up any queries of the forthcoming procedures, as well as to decrease any anxiety and negative expectations. In such a format, Psychological consultation have rather educational character. Psychological support of pregnant women is a separate program which isn't popular yet. In my opinion, the main problems are the low motivation and lack of any recommendations or referrals to a psychologist. The surrogacy program is intended for women who cannot carry out a pregnancy and is based on extracorporeal fertilization. Requirements imposed on surrogacy mothers are aged between 20 and 35, presence of own healthy child, mental and somatic health, consultation and diagnostics by a psychologist of any future surrogates are obligatory. During the interview, I pay special attention to the history of the patient and make sure she has the existence of positive moment from beginning to end. Due to the stress caused by infertility, a sense of guilt and anxiety rises, which leads to depression and restrictions in relations with one spouse. Diagnostic procedures and medical actions lead to strengthening of psycho-emotional pressures, which only increases eventually. Family consultation is devoted to the creation of an accepting and supportive atmosphere in a couple's planned pregnancy. As a result, the comfort and efficiency of interactions with all specialists at the center significantly arises. The integrative method of diagnosing is the analysis of interrelations between the mental resources and the physical state, as well as the external conflicts and their internal manifestation. The integrative psychodiagnostics reveal features of a personality according to which a strategy and the most effective way of getting through medical procedures is provided. The Rorschach test is focusing on highlighting the following: absence of mental diseases, tolerance to stress, lack of dependencies and thinking perception disorder, the level of reality testing, somatization disorder, ability to control emotions. The test can show the following: depressive index, ratio of resources and ambitions, existence of obstacles to recovery, level of a chronic and situational stress, potential to cooperation and quality of a self-assessment. The program of donorship oocytes is intended for women who have no ova and for those for whom there is a risk of giving birth to a child with a pathology. Donorship is anonymous. Selection of the donor takes place according to the phenotypical description. Each donor goes through medical examination. The psychological report of assessment isn't obligatory. When cycle synchronization of the donor and future mother begins, the doctor can invite the psychologist to carry out diagnostics and to interview the donor. Thus, the donor's level of motivation to complete the process can be verified and ascertained. There are cases when the patient goes into a donorship program, but before the egg retrieval procedure is completed, changes her mind and doesn't come. In such situations, the task of the psychologist is to reveal the conscious and unconscious resistance to the process and to write final recommendations for the treating doctor. Psychological problems of infertility and its treatment are very difficult challenges in which doctors cannot be always useful. Only with the cooperation between a doctor and a psychologist there will be a successful and productive path to reach the desired objectives. The number of women wishing to participate or, on the contrary, needing the help of surrogate mothers or donors of ova steadily grows. Therefore, Psychological support of surrogates and biological parents is one of the most actual tasks today. Creation of psychological comfort and working through anxiety and aggression are psychologists' main objectives. In cooperation with a psychologist, patients separate the individual requirements and inquiries from alleged expectations of society. Skills received during psychological treatment help those who are pregnant to become more calm, to control their mood and improve their general tension. The psychologist plays the role of the one who helps to translate rational into sensual and alarming into conscious. Treatment of infertility isn't always included into the register of obligatory medical services and therefore is not covered by insurance companies, making these paid medical services to be expensive. The disappointment and the learned helplessness accompany many patients on the way to parenthood. For this reason, the psychologist and the doctor have to present one moral and ethical idea that they do everything possible for a successful pregnancy but can't guarantee anything. The work of the clinic has been based on the same principles for more than 24 years. It is first of all an individual approach to each couple. Having approached the clinic of the infertility treatment, many patients find not only a doctor, but a reliable assistant and consultant who is ready to support the family in a difficult moment. An open and sensitive relations between a patient and doctor and the psychologist is a guarantee to an effective treatment. One of the oldest traditions of the center is an annual children's holiday for all families which participated in the ART programs in the clinic. Good working relationships amongst the staff create an environment of conducive to successful treatment and result in high morale. For this purpose, on a regular basis, there are Balint groups for doctors where we discuss questions of communication between the doctor and the patient. This work is necessary for identification of unconscious motives and aspects of behavior in an office. Knowing the individual's communicative style better, the doctor can get access to patients' feelings, that in turn improves their interactions and influences the treatment results. The future purposes and assistance of ART patients I see as following. Creation of a full cycle of consultations for women in IVF treatment. Development of consultation and diagnosing standards, formation and support of groups for women who have endured loss, continuation of cooperation development between doctors and psychologists, creation of online consultations for patients from other cities of Russia and from abroad. Dear colleagues, I thank you for your attention and the interest in my work. I hope that you enjoyed my presentation. Please feel free to ask me any questions and don't hesitate to contact me. And of course, I invite you to visit our wonderful city to enjoy white nights and swing bridges.